Welcome to The Explainer. Today, we're going to take a journey inside the human body. We'll be exploring three really incredible pieces of medical tech that let doctors see right through us.
You've definitely heard the names, right? X-ray, CT scan, and MRI. They all let doctors look inside of us. But believe me, they are not the same thing. So how are they different, and why would a doctor choose one over the other? Let's break it all down.
All right, let's dive in by starting with the original, the one everybody knows, the classic X-ray. You know, the basic idea here is brilliantly simple. Just think of it like a special kind of flashlight. The X-rays, which are a type of radiation, shine right through your soft tissues, like skin and muscle, but they get stopped by denser stuff, like your bones. The picture you see is basically a shadow of your skeleton.
So the most important thing to remember is that an X-ray gives us a flat 2D picture. And there's a good reason it's the most common scan out there. It's incredibly fast, it's cheap, and the radiation dose is super small. It's the absolute champion for checking out bones, but it's also a great first look for problems in the chest.
And this really shows its power beyond just broken bones. I mean, look at this. A simple chest X-ray can help doctors quickly spot serious problems in the lungs, things like pneumonia or even cancer. It's an absolutely invaluable first step in figuring out what's going on.
Okay, so that's the classic. Now let's see what happens when you take that idea and give it a serious upgrade. Let's talk about the CT scan.
A CT scan isn't really a totally new technology. It's more like a superpowered X-ray. Instead of just one flat image, a machine actually rotates around you, taking a whole series of X-ray pictures from all different angles. Then a computer takes all of those images and stitches them together into a detailed 3D model.
The name itself, computerized tomography, kind of gives it away. Tomography literally just means a picture of a slice. So here's a good way to think of it. If an X-ray is one photo of a whole loaf of bread from the outside, a CT scan is like getting a detailed picture of every single slice inside that loaf.
Now this slide really shows the incredible leap in detail. On the left, you've got your standard flat X-ray. But then on the right, wow, you see a CT scan's cross-section of the spine. The level of detail in that bone is just amazing. You're not just looking at shadows anymore, you're seeing the real intricate structure. This crazy level of detail is what makes CT scans so valuable. You get these 3D images, they're faster and usually less expensive than an MRI, and the machine is quiet. The trade-off, of course, is that it does use radiation. But this is exactly why it's so good at spotting complex things like blood clots, tumors, or internal injuries.
So we've seen 2D and 3D images made with radiation. But what if you need a really detailed picture and, well, you want to avoid radiation entirely?
This is where the whole game changes. Meet magnetic resonance imaging, the MRI. It uses a completely different playbook. Instead of radiation, an MRI uses a seriously powerful magnetic field and radio waves to make its pictures. That means absolutely zero ionizing radiation.
And this slide puts it in black and white. You can think of X-rays and CT scans as being on team radiation. The MRI, on the other hand, is on team magnets. It's a fundamentally different way of seeing what's happening inside you.
The MRI's superpower is its unmatched ability to see soft tissues. This is what makes it the absolute gold standard for looking at the brain, ligaments, the spinal cord, and joints. So what are the trade-offs? Well, it takes a lot longer than a CT scan. It's more expensive, and if you've ever had one, you know that machine is incredibly noisy. This comparison says it all. I mean, look, on the left, the CT scan gives us a great look at the bones in the spine. But check out the MRI on the right. All of a sudden, the spinal cord and all the soft tissues around it just pop out in stunning detail. The MRI is literally seeing things that the CT scan just can't.
Okay, so now that we've met the contenders, we get to the big question. How in the world does a doctor decide which one to use?
This table right here is pretty much the ultimate cheat sheet. You've got the X-ray, 2D radiation, best for a quick peek at bones, but the trade-off is low detail. Then there's the CT scan, 3D radiation slices, amazing for tumors and internal injuries, but it comes with more radiation and a higher cost. And finally, the MRI. It uses magnets, it's the champ for soft tissue like the brain and spine, but it's slower, more expensive, and noisy.
So you see, the crucial thing to remember isn't about which scan is best. There really is no single best scan. It's all about using the right tool for the right medical question.
If your doctor thinks you have a simple broken bone, a fast, cheap X-ray is the obvious choice. But if they're trying to find some subtle ligament damage in your knee, they need the soft tissue superpower of an MRI. And as these incredible technologies get even faster, more powerful, and more detailed, it leaves us with a pretty fascinating question. We've got one that's fast, one that's incredibly detailed, and one that uses magnets instead of radiation. Which of these approaches do you think is going to change medicine the most in the next 10 years? Thanks for watching.